Hello, I'm Annie Ersling, and I'm here at the National Association for Home Care and Hospice. I'm here with Melanie Stover. Melanie is the owner of Home Care Sales.
Hi, thank you for having me.
Yeah, thanks for being here. Tell us a little bit about Home Care Sales and what you do.
Thank you for asking.
Yeah.
So at Home Care Sales, we help agencies grow. And we help them do that through empowering their sales reps and also their clinicians, because we know that some of the best salespeople are actually clinicians, even though they hate the word sales.
Absolutely, yeah. Yeah, so that's great. So what are some of the biggest challenges you run into with some of your clients? What are they dealing with on a regular basis?
Yes, so what we see most often is that sales reps, or marketers as some people call them, or liaisons, don't actually have a process. So as a clinician, oftentimes we have clinical pathways, and through those protocols we feel structure and we feel freedom in those to treat the patients. The sales reps often don't have that structure, and so therefore they're not able to gain those repeatable results that the owners so want. So one of the very first things that we do is teach them sales process and give them that step-by-step formula so that they can gain referrals consistently over and over again.
That's awesome. So talk a little bit about why you're in home care. What makes you in hospice? What makes you passionate about this industry?
Thank you for asking, because as a clinician, I'm an OT by background. And one of the things that I knew is that patients who deserved care didn't always get a referral. And so therefore it was my mission to figure out how could I gain more referrals so that people could get the care that they deserve. And the best way I thought I could do that is by working with sales reps and working with organizations and their clinicians in order to create a greater impact.
That's great. So the theme of this year's conference is authentic leadership, which I think is fantastic. What does that mean to you? Authentic leadership, and how does that motivate what you do in your business?
So we know that referral sources respond to authenticity. If someone comes in and doesn't have a plan, or they're just kind of winging it, it doesn't give them the confidence that they need in order to refer to you. But when you're authentic and you couple that with a plan, either by diagnosis or patient condition, you're going to get the results that you want, and the leadership is going to help you get to that next level and take the quantum leap in your business.
That's awesome. What keeps you up at night, and what are you most excited about with the future of home care?
So what keeps me up at night is making sure that agencies get a seat at the table. So often we know that home health, hospice, and private duty are the answers to many of the challenges that the healthcare system is facing. My biggest concern is, are the agencies getting there? Are they getting a seat at the table to have those discussions? Or is the hospital having these discussions without them and later trying to finagle in and figure out where they fit? So my main concern right now is, are they getting a seat at the table? And the thing that most excites me is we're finally getting a seat at the table. For a long time I've been in healthcare, and specifically home health, since '96, started Home Care Sales in 2001, and since that time, specifically private duty has not really had the accolades that it deserves. And now we're seeing that change with the Medicare Advantage programs, looking at private duty as an option for them to care for their members. I think it's a great time to be in all healthcare, post-acute care specifically, home health, hospice, and private duty.
Yeah, I could agree more. I think that this is such an exciting time to be a part of home health, and I really appreciate your comments and your passion, and thank you so much for spending some time with us today.
You're welcome. Thank you.